Hi, and thanks very much for your interest in studying social policy or health and social care at the University of Kent. Normally, we'd be doing this talk in a room on our beautiful campus. Unfortunately, due to the current circumstances, I'm giving you this talk from my spare room. So apologies if you can hear cars going past or indeed trains going past. But this is the situation we're in, and we'll do absolutely everything we can to try and give you as much of an experience of what life will be like as Kent as we can. So, the first thing to say is that social policy isn't necessarily something you'd have studied at A-level. I know there is a module on the sociology A-level that some of you may have done, but it's not necessarily something that you will know about particularly, and I hope you're here because you think that's something that sounds exciting. So because of that, we asked our existing social policy students what they thought social policy was, and I think these are some lovely quotes from them. So one of our students said, social policy is the understanding of how welfare states, governments and economies and their group decisions affect our day-to-day life, from our education system to our NHS. I think that's really nice because social policy is hugely broad. It covers loads of different things that the government does, loads of different services the government provides, and the decisions they have to make about what they provide and what they don't provide. So another student says, social policy looks to understand the scale and cause of social problems and seeks to establish how societies and governments could respond to them and establish resolutions. And I love this quote because we all care about something. There are problems in society, whether it's homelessness, whether it's particular groups in society being discriminated against, whether it's education, whether it's about something that's been in the news today, about free school meals. There is always something that we care about, that we're passionate about. And in order to drive change, what we need to do is understand that problem and be able to articulate clearly what solutions could be done to make it better. And that's what social policy is. That's what we study. And if you come to Kent to study social policy or health and social care, that's what we would equip you to go out into the world and do. So social policy is about 2/3 of total public spending in the UK. So about 2/3 of everything the government in the UK spends goes on something that we could define as being social policy. Obviously there's things like policing and military that fall outside of that, but everything from education to health to pensions to social security fall under. And it's about 1/4 of the total GDP of the UK. Think about that. 25p in every pound that's spent in Britain is spent delivering some form of social policy. Now that's a huge amount of money, and therefore you need to know a huge amount to make decisions about how to best spend that. And that's what a social policy degree or a health and social care degree will give you. So just think about a few of the pressing issues of our time. Think about the growth of food banks in the UK. Do we know why food bank use has increased by so much? Is it to do with greater food poverty, or is it to do with excess supply of food, so food is going spare? Is it because food poverty is more visible now, that people are more able to respond to it? Or is it to do with government policies in recent times? Think about obesity. Again, this is the first time in history that richer people have been thinner than poorer people. Why is that? What has changed in society? How can we address that? Is it best to ban fatty foods? Is it best to add a little bit extra money so that my full fat Coke costs a bit more than Diet Coke? Or are there other things we can do? Other ways we could spend money, we could spend influence in a way that changes things? What about politicians? They're making decisions, and they're making decisions that are often way outside of their knowledge base. Think about conservative politicians saying that anyone can live on £7 a day. Well, that's easy if you've already got a house, if you've already got lots of other things that you need to supplement the day-to-day expenditure. But if you haven't, how do we go about giving people that sort of rock, that basis for good life? And then, of course, there's things like housing. And when housing decisions are made that are bad, that can have hugely tragic consequences. This week's been the 3rd anniversary of the Grenfell disaster, a huge tragedy that could have been avoided if policymakers had thought differently about certain things, if they'd seen the importance of providing good quality social housing rather than just quantities of social housing. These are all social policy issues. These are nearly all health and social care issues, and these are things that you will get to study if you come to Kent and do social policy or health and social care. Because what we look at is solutions. We look at ways you can map, ways you can teach, ways you can provide care, provide housing to solve the pressing issues of society. Because it doesn't have to be a depressing story of food poverty. It doesn't have to be a depressing story of obesity. Instead, it can be a positive story of education helping people to get on in life, of social care being properly delivered in a way that allows people to age with dignity. And by studying it and by looking at the right responses, we can get the right way, we can learn, we can deliver a better society. So again, looking back to what our students say, social policy studies are incredibly important in empowering individuals who are politically, socially and economically marginalised. If that sounds like the sort of thing that you care about, the sort of thing that moves you, that will be a great thing to come here and study. I saw it as a social science with a clear practical application that would provide me with complementary knowledge to my existing work experience. Issues of social inequality make me want to take action. And I particularly think it's worth focusing on the clear practical application here. This isn't necessarily a vocational degree in the way that something like law is, but it is a degree, social policy and health and social care, that have clear practical applications, clear uses. The ability to take a situation, to analyse it and propose change is clearly hugely important for a wide range of different jobs. So why come to Kent? Well, Kent is an excellent university. We're ranked 21st in the Times Higher Education table, and we have a Teaching Excellence Framework Gold, which is the highest rating that you can get based on a number of different measures. So Kent is a good institution, a really good institution. So what do our current students like about it? They're probably the best people to ask. Well, they like the diversity of module options. We teach social policy and health and social care, but we're also in a school with sociology and criminology, and you can take modules from across those different disciplines. They like the interesting and informative seminars. For every lecture you will also have a seminar where you could discuss ideas both with your lecturers and with other students. Modules have practical application, as I've already said, and it's very up to date with current issues. We are able to respond very quickly to things like climate strikes, things like Black Lives Matter, and of course, coronavirus, and build them into our teaching. Students say they like the support and encouragement from members of staff who go the extra mile to engage with you and encourage your progress. And I look around all of my colleagues and that's absolutely true, as is that we provide a generally supportive environment for you to study and achieve your best. We have a lovely campus. It's big, it's green, there's huge amounts of open space. If you're coming here in normal times, there are lots of wonderful meeting places, but even in these kind of weird COVID times, there is a huge amount of outdoor space and you will never have to get on public transport. To get down to town is a 20-minute walk. To get back, it's a slightly harder 20-minute walk because it's uphill. To get around campus, you can walk. The main student accommodation is maybe a 5-10 minute walk from where your lectures and seminars will be. So even in COVID times, it will be a very safe place to come and study, and when that dies down, it will be a really fun and vibrant place to come and study. There are bars, clubs, music venues on campus and in town that you can enjoy, as well as sports facilities and everything else. So here's just a few of those examples of bars, of tennis courts, of music events and all sorts of other things. And it really is a fun place to be, with a huge wide range of activities, from sport to music to charity and fundraising and all sorts of other things as well. So what will you study? Well, in the first year, you'll do a module that I will teach you called Social Policy and Social Control. And then in the second term, you'll do a module called Health, Care and Wellbeing. And these are the core first year modules for social policy and health and social care students. You'll also do a module on critical thinking to get you to think behind the news, behind statistics, and to think more critically about the things you're reading, the things you're studying. And then you'll do 2 sociology modules that will give you a grounding in the theory that will be really useful in your social policy and health and social care modules and studies going forward. In your second year on both programmes, you'll study Welfare in Modern Britain, which is our big 2-term overview of the British welfare system, and Social Research Methods, which teaches you how to be an effective researcher. In your third year, if you do social policy, you'll do our module, A Future for the Welfare State. So in your second year, you looked at the British welfare state. In your third year, you go on and compare welfare states from around the world. Compare the British case to other cases in Europe, in America, in Africa, in Asia, all around the world, and compare the different ways in which we organise welfare and the ways in which we can borrow the good elements of different welfare states to create the best possible outcomes for British citizens. And if you're doing health and social care, you will also do health and health policy, caring for vulnerable adults, and health, illness and medicine. You can do them either in your second year or in your third year. Now, if you're a social policy student, you can, of course, do these modules. You don't have to, but you can. And if you're a health and social care student, you can do the module I talked about on the previous slide. There's huge amounts of flexibility, but these are the core modules you have to do. And that flexibility is hugely wide-ranging. You can do modules on poverty, on the care and protection of children and families, illness and medicine. You can do modules on charities, on mental health. You can do a module where you go out and do volunteering in the community that I run. Modules on selfies and individualisation, on the sociology of status, on ethnicity, identity, on animals, on the sociology of the global south. Really, the range is as broad as you could possibly imagine. And each and every one of you listening to this will almost certainly choose a different combination of modules. So you absolutely have the freedom to make the degree programme your own. And of course, there's more. You can study abroad on all programmes. Social policy, health and social care, whatever else you study, you can choose to study abroad. You have a huge range of options. Canada, Italy, Finland, Netherlands, Hong Kong, Singapore, Spain, USA. Really, really straightforward to go about signing up. All you have to do is be doing fairly well in your first and second year. And then you go at the end of your second year and you come back before your third year. So essentially your degree becomes 4 years with a year somewhere really cool doing something really interesting. Language requirements vary, but teaching is often in English. Canada, Finland, Netherlands, Hong Kong, Singapore, USA, obviously the teaching will be English. If you want to go to Italy, Spain, France, Germany, the teaching might not be and you'll have to pass language requirements, but if you've got that language, brilliant. And you can learn to be comfortable with numbers, and this is such an advantage when you go out into the workplace after your 3 or 4 years with us. We are one of 18 Q-STEP centres. This is a particular focus on quantitative research, so numbers and understanding numbers and data and statistics. And that means you get specialist expert training in quantitative methods, and that's unusual for a social scientist. And that's hugely valuable in the workplace because you get a combination of statistical skills, but also the ability to think critically and to have a knowledge and understanding of a wide range of social issues. You will be very rare among graduates in having that mix of skills and very employable as a result. And you get to learn from experts. We aren't just teachers, we aren't just teaching you. We are going out there and doing the research and trying to change the world ourselves. Colleagues have recently written books on children's charities in crisis, on austerity, on medicine and so on. And I wrote the Complete Volunteer Management Handbook to try and influence the way in which people are actually delivering things on the ground. And of course, once you leave here, as I've already said, you will be hugely employable. 96% of our social policy and health and social care students are in work or further study within 6 months of leaving us. That's a really, really very high percentage. And social policy and health and social care students who graduated from us in 2016 were the most successful in the UK of any social policy course at finding work or further study opportunities within 6 months. So this is a really good pathway into meaningful, enjoyable, and hopefully quite well paying employment. And there's a huge range of careers you can go into. Some of the obvious ones are things like the civil service, social work, policy analysis, researcher, but also NHS management, working in charities, teaching, campaigning, doing special needs education, human resources, managing social care, probation officers, postgraduate study, local government, but really anything. Because you will have skills to be able to look at something, understand it, and suggest how to improve it and change it. And that's invaluable. So that's all I want to say to you. We have a number of open days that you'll be told about where you can come and ask me questions live, but you can also email the university, email me and ask questions at other times as well. We are doing our very best to give you as much information as possible, so to make your decision to come and study at Kent hopefully as easy as possible. Thank you very much.